Tennis elbow is the most common condition that I see around the elbow, and a majority of orthopedic surgeons who deal with elbow problems see. Basically, it is an overuse injury of the extensor tendons on the outside of your elbow. And because those extensor tendons move your wrist and fingers, it's a lot of times due to repetitive activity. It traditionally thought of, the backhand of a tennis swing, but a lot of patients who have this who just work a repetitive job with their hands a lot, or it can actually happen over time just from attritional kind of wear or just being, alive for the amount of years that a patient is. Symptoms of tennis elbow have a variety of ways of presenting, but generally what patients will say to me is that it becomes very difficult to lift objects up that don't weigh very much, such as a coffee cup or a ball, or just even a simple set of keys, car keys. Patients will also state that the pain hurts on the outside of their elbow and can sometimes wake them up in the middle of the night if the pain is severe enough. Other symptoms can be kind of burning or numbness that goes down into the front of the forearm, into the hand area as well, and that all kind of stems from the outside area of the elbow. A lot of patients that I have will have tried some form of non-operative treatment prior to seeing me for tennis elbow. I think a lot of patients know about kind of the tennis elbow strap that they will put on. Unfortunately, sometimes patients don't know exactly where to put that or how it should feel, how much pressure it should apply. And so if that's not working and a patient's tried, anti-inflammatories, still not working, or any pain that wakes them up at night usually indicates a higher level of pathology. So that's when I'll generally see patients, or they should seek care. Tennis elbow does not usually need any form of imaging study to really look at the diagnosis. We can most times make it based on history and a good physical examination. Treatment options for tennis elbow can range anywhere from the simple home stretching and strengthening program for the elbow, all the way up to arthroscopic, assisted, or open surgery. Surgery should be a last resort for tennis elbow. A majority of patients, I would say over 95% of patients that I see for this diagnosis, respond well to conservative treatment. And so if that fails, and we're talking here, multiple months of treatment with physical therapy, injections of either corticosteroid or PRP, and the patient has MRI evidence of extensive tearing in that region, that's when surgery will be indicated for tennis elbow. Surgery for tennis elbow, as we stated, is a last resort, but basically what the surgery entails in any form is taking out the part of the tendon that is torn and diseased, as it is a disease process of the tendons as they tear and are unable to repair themselves. So we take out the diseased portion of the tendon, and because there's a lot of redundancy in the extensor tendons around the elbow, we just stitch back together the part that we took out with the normal healthy tissue, and that takes care of the problem. I generally tell patients the whole recovery process takes about 3 months. The first month they're generally in a sling around the elbow to allow things to heal in the incision and from the surgical site as well. The deeper tendons and muscles. And then the second and third months are really getting full motion back, as well as strength, and getting the patient back to their activity that they would like to do.